everyone. Welcome to Empowering Exceptional Minds, the podcast diving into neurodiversity through real conversations with parents, individuals, and professionals on challenges, strengths, and unique experiences. I'm your host, Mayan Glazer-Corin, educational therapist, ADHD educator, and ASD certified specialist. At Educational Therapy LLC, we support kids and adults with executive function and learning differences toward confidence and independence. This podcast collaborates with WIS Therapy, connecting individuals to providers and streamlining services for neurodiverse communities. Our goal is to share strategies, stories, and insights to empower families, educators, and professionals. This podcast is for informational, educational purposes only and isn't medical, psychological, or legal advice. Consult professionals for concerns. Guest views are their own, not necessarily the host's or with therapies. By listening, you agree neither host nor guests are responsible for actions based on this content. A quick note, for concerns about well-being or mental health, contact a doctor or professional in your area. For emergency, dial 911. Crisis text line, text 741-741 anywhere in the United States. Hello, and please join me in welcoming our guest today, Dr. Mary Beth Burns. As a seasoned educational therapist with over 2 decades of hands-on experience, Dr. Burns has dedicated her career to supporting students with learning differences. Today, she'll share invaluable insights from her work, including how ADHD impacts the acquisition of reading skills and reading comprehension. Get ready for an enlightening discussion that could transform how we approach education for those with neurodiverse needs. Welcome, Dr. Mary Beth Burns. Please introduce yourself and tell our listeners how wonderful you are.
Oh, Mayan, thank you so much. I'm so happy to be here with you today. I consider you a valuable colleague and a good friend, and I am happy to share with your listeners some of my experiences over the last 30 years. But to just briefly introduce myself, I have a doctorate in education with a specialty in literacy, looking at the diagnosis and remediation of reading disabilities. I also have a master's in educational psychology. I've worn many hats over the years. I've been an educational therapist, a professional educational therapist since 1996. And I also have taught at several universities on the East Coast and the Midwest. It's one of my passions, teaching the teachers. And I've done teacher training for Educators Publishing Service. I've written curriculum for Boys Town's literacy program and other literacy organizations. And I'm going to share with you quite a bit of knowledge today and look forward to having this conversation with you. So thank you so much again for inviting me.
Thank you so much. I actually invited you to talk a little bit about, well, hopefully not a little bit, but how ADHD affects the process of learning and especially the process of learning to read and reading comprehension. We're not talking about dyslexia per se, we're talking about ADHD. So can you start by sharing how ADHD can affect the process of learning to read, even in children who don't have a reading disability?
Absolutely. That's a very good question, mine. So it wasn't until, like, I would say the last 25, 30 years that we began to realize about and understand the significant impact ADHD has on the learning process. Because if you are unable to attend and sustain attention to task, then you are going to be at a disadvantage in regards to gaining new knowledge and learning. And the complexity of language and its connection to learning to read has many facets. It's multifaceted, and what we didn't realize until probably I would say 30 years ago is again that there are individuals that are struggling with learning to read that we have no understanding of, when after assessment we realize, well, that they don't, they're not exhibiting any difficulties with phonemic or phonological awareness. Why are they struggling? Why are they lagging behind? And there's been so many studies done over the years in this area because we have been, as a community, curious about how big of a role does ADHD have with the learning process. Now, it affects academics across the board, and we do know that children that are untreated, diagnosed children with ADHD that are untreated, that they will lag behind their peers. And by the way, this has nothing to do with intelligence. So most individuals with ADHD are at least average to above average intelligence. Um, but they, will struggle in many ways. And because ADHD impacts executive functioning and working memory, that that also has a negative impact. So what do we know is that children who are exhibiting in kindergarten difficulty with acquiring understanding and knowledge of around even letter recognition, and understanding, those simple concepts around syllabication, being able to clap out syllables, being able to assign, and the sound to the symbol. So letter sound correspondence, that those children are going to have difficulty throughout elementary school when they are exhibiting difficulty in kindergarten or early first grade. But again, we have to ascertain and we have to figure out why are they struggling. And in the past, the assumption was, oh, they have some type of reading or learning
Hmm.
disability. But in my career, I have seen many, many, many children who were diagnosed, for example, with a reading disability or dyslexia. And upon assessment, I realized that those skills that, are needed to read, their phonemic phonological awareness was intact, but they were still struggling readers. They were lagging behind. And again, it depends upon where they are on the spectrum of ADHD, mild to moderate to severe. But moderate to severe individuals with ADHD, again, they are so distracted, not only externally, but internally. So they're not attending to the teacher's voice, to the teacher's instruction. They're thinking about what they're going to do when they get home from school, um, what they are going to have for lunch. They're thinking about so many other things. They get triggered very easily and experience what we call free flight of ideas. So the teacher might mention something that triggers, an idea or a memory for them, and now they're thinking about that particular trigger. They're not attending to instruction. And then again, too, they lack filters. So they cannot filter out, noise. They're easily distracted by what is happening in the environment around them. So you have the external distraction and the internal distraction. And again, if you're paying to, attention to all those other variables in your environment, you're not paying attention to the teacher, then you're missing out on all that instruction.
Yeah, that's a very good point. You were just saying this, and all I was thinking about this client that I had. She was younger. Now she's in middle school. But back then, I remember that we were talking. She was reading something about cake. And then she was gone because she was in the last cake that she went to, and then that was reminding her a birthday party that she
Yes.
attended, and that's it. And we were done. We were in the birthday party right now. We are not attending, that story about the cake.
And
And I
that
was like, this is
exactly
so
what
interesting. So that's
it,
just to kind of give examples to our readers, to our listeners,
yes.
sorry, of how it will can look like. Another thing, and I'm gonna just throw it at you. I was thinking about, and again, because um, in my work with clients, what I noticed that many kids who do have the phonemic awareness intact,
Mm-hmm.
and if our listeners listen to our last podcast with the auditory processing, we talked more about that during that as well. Um, but what is happening that sometimes we are seeing kids that will never diagnose with a learning disability. Um, they do have ADHD, but then they also have orthographic processing challenges. And these
Mm-hmm.
are the kids who are flying, under the radar, and they
Mm-hmm.
will fall between those gaps. And because some of them are so connected with the orthographic loop when it comes to that as well. So I just wanted to be clear that this is also can be something that is happening, and orthographic processing is something that, and please correct me if I'm wrong, also being said this is surface dyslexia. Um, and this means that the kids that have this might be able to read. They will read. They might read slowly, but they will spell the way they hear it. So the spelling will be phonetic. Am I correct?
Correct.
Okay, great.
That is right, spot on, mine. And the other thing to take in consideration when you think about orthography is that what we are hoping students will gain an understanding around is the the way that letters, line up to represent different sounds. So like DGE says J. So when you have a child with ADHD who has difficulty again attending to instruction, attending and sustaining attention for any period of time, and is struggling with working memory, well, learning those orthographic patterns is very reliant on working memory. And being able to represent them accurately in your spelling um, means that again you have to be able to take that knowledge in to understand that again like DGE is not it's not phonetic, it's like bridge, you know um judge, DGE represents j. And so when you look at all those different orthographic patterns and also like vowel consonant LE, like some of those patterns that children without a reading disability or an attentional problem will automatically, just from exposure,
Mm-hmm.
even exposure to print and text, they will automatically be able to identify and recognize those patterns. Children with ADHD do not, because again, you're holding a unit, and you have to sequence it correctly in your brain to be able to then you know apply it and to understand again, so like when what words contain TCH versus CH. So TCH like watch versus church.
Mm-hmm.
And all of that is all of those orthographic patterns are really they're they're very there's just so many complexities to them, to learning them and when to use them, that do not involve phonemic or phonological awareness, but really rely on attention and working memory. So ADHD children specific like they typically have a lot of difficulties with those type of irregular orthographic patterns, and they will often reverse letters just because again they're not attending. And it's not because they have dyslexia or reading disability, but because they're not attending. And if you say to a child with ADHD, can you go back and look at that again, they the children with ADHD 9 out of 10 times can self-correct.
Right.
The children with the reading disability and dyslexia do not cannot.
Yeah, we're also talking about dysgraphia in that case when they're
Exactly,
mixing
exactly,
BD, Q, P.
exactly.
Mhm.
And typically children with ADHD often have horrible writing, um, because their writing is, difficult to understand. I can't tell you how many students I've worked with, Mayan, that can't read their own writing. They can't, decipher it because, again, if you think about the impact of ADHD on the frontal lobes, well, where's the motoric area? It's in their
Yeah.
frontal lobes. So, it's related to that. So consequently, it affects, that's why too, they have usually awkward gaits. Like I used to be able to, quite honestly, if a child was medicated, and I've been in practice a very long time, so this is before there was long acting medications. So then that meant that mom was giving a dose to a child after school before I saw the
Mm.
child. And I could tell by the way they were walking into my office and what they were stopping to do, to touch, to, look around. And their gait was always the pace was quickened. I could tell whether they, had received their medication 15 minutes ago, half an hour ago, or maybe not at all. Now,
Yeah,
some
I
of your
could.
some of your listeners maybe say, "Wait, what?" But those of us who have worked in the field with children and adults with ADHD for a very, very long time, there are many indicators that may be anecdotal, but we all embrace. So many good psychologists, clinical psychologists that I work with that have, that do assessment work, that I work collaboratively with, will say they purposely put like a chair, a swivel chair in their offices because the ADHD kids like that stimulation, and they would be like a whirling dervish. Like they'd be just like turning around and round and round for like, minutes on end.
I have
So,
one of those too, and I can tell you.
so you know,
So which kids are on the meds and which are not. And even when I, service clients online, when there are I just thinking about one specifically, and I know when they are on the meds and when they're not, because then I see like slouching more and like slowly they disappear into the void. And I'm like, hey, what's up? They're like, oh, I didn't get my meds yet. And I was like, okay,
exactly.
do you need a break? Let's go do something, move your body. But we are like this is was a side note because um we both of us know how it looks like with meds and without meds, and it's definitely a personal and parental choice. We just want to remove all the stigma about it because these meds exist and
Absolutely.
they change our clients' lives, and we see it. And they will say that too. Yes, we are not pharmacists. We're not going to talk about it that much. They do have side effects. So please talk with your pediatrician or psychiatrist when you are looking to add this. But there is a reason why they exist.
Exactly. And what we're trying to do, people don't understand the value, not only the value, but the purpose of medication. We're trying to raise dopamine levels in the brain so
Right.
that those dopamine levels are, you know, similar to a person without ADHD. And we have so much research on stimulant medications, more so than even I have heard well-respected experts in the field say, more so than even antibiotics, because we have been tracking and using stimulants for, they're used for other purposes, by the way, too, like narcolepsy. But we have been using stimulants to treat individuals with ADHD going back into the 1800s, even. So, what we do know is that it's a neurochemical disorder, and medication isn't the only treatment. It should be a multimodal treatment approach. But we know that medication, like you said, very accurately, mind changes people's lives. And um, I I have heard from parents more times than I would like to even think about that one of their biggest regrets is not treating their child's ADHD medically. And so I don't talk about medication or drugs. I talk about the benefits of medically treating ADHD.
Right.
Be-
And just to
And
clarify, sorry, just to clarify one more thing. I have a colleague and she did an amazing research of how the eyes track when and have visual attention is happening with the meds with ADHD. And there are videos that she showed me, and I was like, it was mind blowing.
Mhm.
So that was really interesting. And I will put link to her website in the podcast.
Excellent, excellent. And by the way, too, for those of you who don't have a strong understanding of ADHD, ADHD is a regulatory disorder. So any expert in the field will tell you it's really misnamed.
Hmm.
It shouldn't be ADHD, but that was the most obvious, you know, um, demonstration of how ADHD impacts individuals is it impacts their attention, but it impacts anything that's regulated. So what that means too, so parents will get confused and they'll say, well, wait, my child can't have attention deficit hyperactivity disorder because they can pay attention and play video games for hours. Well,
Or build
that's part
Legos.
of exactly. But that's part of regulation, being able to shift attention, to be able to disengage. And so also we see difficulties with regulating emotion. We see
Right.
difficulties with regulation across the board. So it's a very, I think we've gotten so much better in understanding the disorder and the impact it has. And there's so much research behind, again, the impact of ADHD on academic school performance is
And
unbelievable.
absolutely. And just to think about it, one out of five people might be ADHD. So that's where the research is. And honestly, I think also many are undiagnosed, especially when we're looking on women in their 20s, 30s, and 40s, because we are the queen of masking. And for many women, it will be internal. And for many girls, it will be internal. And and what I wanted to say about that too is that um, this is why it's not just the hyperactivity that goes with the name. That's why I agree with you. The name is not need to be changed at some point. All right. So from your experience, what are
Mhm,
some of the most common misconceptions people have about ADHD and reading difficulties? And I know we kind of touched some of it.
mhm. Sure, absolutely. So, we know that children with a reading disability will exhibit deficient phonemic and phonological awareness. These are not characteristics, by the way, that are found in children with ADHD. So consequently, it's a matter of, the differentiated like diagnosis, like pulling things apart, like trying to figure out what's interfering with learning. Now, the other concern or the other challenge is that ADHD and learning disabilities have a high rate of comorbidity. So what that means is they often coexist together. And has shown that 50% of children with a reading disability will or 50 to 65% will have ADHD. Now, it doesn't go the other way around though. So
Hmm.
if you have ADHD, it does not mean that you are going to have that same rate of co-occurrence of, 50%. But we do know that ADHD and reading disabilities often co-occur and that it's at a very, very high rate. So it's really important that both of them are treated. And there's been some really good studies in the past, particularly by David Rabner, about intervention and treatment with children that are struggling in reading. And what his research showed us was that if a child has ADHD and a reading disability, and this is a child without medical treatment, okay, if that child receives intensive intervention, they do not make the same amount of progress as a child diagnosed with dyslexia and or reading disability. They don't make the same amount of progress with the intervention because of the attentional factor, which is just really, when you look at the research, it's just really amazing. So those children that have ADHD and a reading disability are really behind the eight ball, because even if you have high quality, intensive, you know, scientific intervention to address the reading disabilities, if you don't address the attentional piece, they will not make the same amount of progress. And again, that has been shown in the research over and over again. And that's very, very concerning. So you have educators who are struggling to close that reading gap. But if you have ADHD in the mix that is untreated, the progress is going to be extremely slow.
How will it look like? Um, I'm thinking because I mostly work with middle school and high school and
Mhm,
college. So how will it look like, when they need to read a novel? I have many clients who say, I hate to read. They don't have dyslexia, but they hate to read.
mhm.
Um, and I always try to tease out what's going on. Okay, you don't have to love reading, but when you have an assignment from school, you need to read. And I'm not talking about just about reading a novel for your, language arts or social studies, but you also need to read a math problem that
That's
it's
correct.
maybe a paragraph long.
Mhm. That is correct. And so if you're having difficulty sustaining attention to text, it's going to impact all the content areas. And I can tell you from my professional experience, I have worked with many college students and even adults who had never read a book cover to cover before their ADHD was treated. And because it's so difficult to sustain attention to text, and then they also, their mind wanders so much, they have to go back and reread. So the the surprising, you had mentioned to me or asked me before, Mayan, like what is, like what is the total impact of ADHD on reading? It's not just on the acquisition of phonemic and phonological skills, it's also in the area of comprehension. And so consequently, individuals with ADHD who are good readers who do not have, maybe they have just mild to moderate ADHD, and so it did not impact their acquisition of reading skills, they're still going to struggle with comprehension because they can't sustain attention to text. And there's been some really good studies in this area too around passage length. So we know that individuals, when I'm doing assessment work, I know that if I suspect there's an attentional factor that is playing a role here, I know that the individual I'm assessing or evaluating is going to perform better on a short passage of under 100 words versus a long passage. And when you ask for a retelling, their recall is always poor. And you get the beginning of the passage and the end, but not the middle. Because again, sustaining attention to text for any length of time is difficult. So one of the, tools on my tool belt is to find something of high interest. Because if the text, that novel, is of high interest to them. It doesn't matter whether it's fiction, nonfiction, narrative versus expository. They're more likely to engage in the text and be able to sustain attention to comprehend the text. Because remember, reading's really about gaining meaning from the text. It's about understanding what you read. So that being able to find out and discover what really motivates that individual, what they're excited about learning more about, is really helpful in helping them to engage in the text. But what does that mean? That most of what we read in the content areas, specifically social studies and science, is not all that interesting.
Mm-hmm.
So again, individuals, children with ADHD tend to struggle more in those content areas. And then, as you mentioned before, with math problems, anytime you introduce language, you introduce text into the math problem, where then they have to discern what information in that word problem is important versus what isn't. That's very reliant on working memory. And then you have to, do the calculations. So children with ADHD, even if they have solid understanding, they have good, like, a good grasp on their math facts, they will struggle with word problems because trying to parcel out which parts of this word problem is pertinent to me finding the answer is difficult for them because again, it involves a heavy cognitive load on working memory.
Absolutely. And then they also need to write it to show the steps.
Exactly. And they love shortcuts. Individuals with
True.
ADHD, because sustaining attention is so difficult, they love shortcuts. That's why, adults with ADHD really struggle with task completion. They start one task and they get bored and they go to another task and then they, oh no, I'll finish this later and then they go to another task and they will avoid those tasks too that have a heavier reliance on working memory and require more sustained attention.
And that will show also while responding your boss email, right? So it will affect your work.
Absolutely. And again, your accuracy, because that's again with children with attentional problems, they are not accurate readers. They tend to skip lines, they tend to skip words, they don't track well. And you mentioned before eye tracking. I mean, early in the days of my career, like 40 years ago, they really believed that eye exercises, eye movement was really pertinent and to reading text and to gaining knowledge from what you're reading. But it's ADHD children they don't track well, and they tend again to skip lines, they skip words. That's not something you see in children with dyslexia or reading disabilities because
That's
they tend
right.
to be more methodical. Yeah.
Yeah, they will guess the word, but they will not skip it.
That's right. That's exactly right. And the other thing too you see with children with ADHD is because again they're not attending to the fine details. They will substitute words that have similar meaning, like house for home. So maybe they don't understand OU says ow. And then that E on the end of house is confusing the heck out of them because they're thinking, oh, silent E. Wait, that should mean like that O or the U says its name or something. So they will often substitute words that have similar meaning, but it's not the word on the page. Where a child with dyslexia or reading disability, you do see that behavior from children with reading disabilities sometimes, but it's very prevalent in children that have the attentional factor that's interfering. And again, they're always very very slow readers. Their fluency is always negatively impacted. And if I can just tell a little story, one time years ago, I'm a big fan of like Joe Torgerson, and Fletcher's work. And I went to a conference in Philadelphia, and I was asking the presenter, or expressing to the presenter that I'm making great gains with my struggling readers with their decoding, but their fluency is so poor and their words per minute rate is very poor. And this individual that said to me, well, by any chance, do they have comorbid ADHD? I said, yes, they do. He said, well, if you want their fluency to improve, they need to be treated medically.
Mm.
You need to bring in the Ritalin factor. So, I mean, that was so telling to me, um, that wow, but again, we went through a stage or a period, mine, where there was so much emphasis on fluency. We now know fluency is not all that important. It's more about gaining meaning from the text. And if you have a slow, methodical reader, but he or she understands what they have read, that's much more important than reading 100 words per minute.
Yeah, absolutely. And that relates to, misconception about processing speed. So thank you for saying that. So
Yes.
let's say that got assessments. We know that the root issue was identified. How should intervention strategies differ between ADHD related reading challenges and those caused by a reading disability? Well, we know that for reading disabilities like dyslexia, the different types of dyslexia, we want to
Yes.
do the systematic Orton Gillingham Wilson reading system, right? Something like that. Um, so how it's going to look like for ADHD though?
So children with ADHD that have gaps in their phonemic and phonological, awareness, and specifically they have difficulty with the orthographic patterns and with the sound to symbol correspondences. They benefit from the same type of evidence-based, instruction. I'm Linda Mood Bell trained. So, and for those of you out there who want to know which one is better than the other, they all are based on the same principles. So Linda Mood Bell, Wilson,
Mhm.
Orton Gillingham, they all will address the need for instruction, good, solid, evidence-based instruction for improving, phonemic and phonological awareness. Um, but the difference with ADHD children, the one big difference, if parents aren't ready to medically treat them, is the frequency. They need much more, they need many more exposures. They need many more opportunities for reinforcement than a child with a reading or a learning disability. Because again, that working memory factor. So they don't hold on to information. It doesn't move from their working memory to their short term to their long term memory. So they need many, many more exposures. And again, it's a challenge for all of us as practitioners, as clinicians, but we need to keep them engaged. We need to find ways to make it interesting, and and again, taking a multimodal, multisensory approach is very important for addressing children with ADHD's reading difficulties. It's very important. So it's not that, children who are struggling readers because they have a reading disability or dyslexia, which again falls into that category, but it's not that they need different instruction.
Mhm.
A struggling reader will benefit from the same scientific based or scientific grounded instruction. It's just the ADHD kids need more of it. They need more reinforcement, and they need, to have opportunities to frequently, be exposed to whatever they are working on. The other thing that's really important, mine, is the individualization, to find out what kids know and don't know. And it's really surprising a lot of times. So, some children quickly pick up on, the role of the silent E. They understand that. Other children, especially ADHD children, they don't look at the word like from like beginning to end. They don't look at it as units of sound, as phonemes, because they're always trying to like, take the shortcut.
Rush it.
So, yes, so they often miss those kinds of cues, like a silent EQ, they'll miss that. So what's really important for a remediation is to know what your students know and what they don't know. Because you can't make the assumption, and there is a developmental, like a scope and sequence that we follow. So we know that, kindergartners should not be learning about, R controlled sounds, vowel plus R. They're not ready for that. They're just not ready for that. But so that scope and sequence is important. But again, you want to individualize your instruction and focus your attention as the practitioner, as the instructor, as the educational therapist or reading specialist on shoring up that foundation and finding out what they don't know and just addressing that. And to use also, I look at so many different like facets. It's not only the sound to symbol, it's the word families. Can you spot a little word within a big word? Will that help you with an unfamiliar word? Having as many tools as possible is really important for the struggling reader, to have like, many approaches when they come to a unfamiliar word, using contextual clues. You know, I mean, there's just so many other little, again, tools and or, strategies they can use. It's
Yeah,
so,
this is
so
why it's
important.
it's really important. I notice there's a lot of discussion now in our area of expertise, especially with reading specialists. Um, when do we introduce morphology? And I was like,
Yes.
you can start morphology on the get-go because we speak morphology. And there is no reason to wait. It's like what you say, oh, can you read the little word in the big word?
Mm-hmm.
Because if you're looking on morphology, we have the base, like the word play, and then
Mm-hmm.
we can add suffixes and we can add prefixes. And then we can have replaying, right? and,
Right.
and then we can
Exactly.
talk about
Exactly.
it. What does it mean to
Exactly.
replay or replaying?
Well, and then
So
you
it
have, ED, lovely ED. So played, because ED makes three different sounds,
that's
you
right.
know. So how do you know which sound does it make? I mean, many people think the English language is much more difficult than other languages. It's really not. It has, its nuances, but there are many, different, what I call sometimes, or you know, ask my children, like my students I work with, like, are there any signals? Or do you see any signals? So there are, cues. There are very specific patterns.
Right.
Now you come to something like OU makes five different sounds. That's really complex, you know, but we know too, like if it's OW, it's mostly going to be at the end of a word, and it's
That's right.
it's going to say O, not ow. There are some instances. But we also have to always remember the English language is built on Greek, Latin, Old English. And so it has, so many other influences. So, you have like CH says like in chauffeur or chef, because that's the French influence versus, and you can have CH, everyone, kids think, oh, CH only says ch, but then CH can also say k, like in Chrome.
Mhm.
So it's just a matter of learning all of those rules. But think about it, for ADHD children, learning all of those nuances around decoding and encoding as well, and learning all those rules is very challenging for them.
It's very fatiguing.
It's very fatiguing. They will often tell you, my head hurts.
Yeah, that's
I
right.
have
Or they
a
will
headache.
start yawning. I like to look at them because I like to do like my observations when they read it. And I like they start yawning so much. I'm like, okay, that tells me that your brain needs some oxygen and a
Right.
break. And I tell them, I noticed that you've been yawning a lot. I mean, I'm not tired. Well, your brain is. Maybe you're
Right.
not. Your
Right.
brain is.
Oh, also, ADHD individuals have a lot of difficulty with sleep.
Yeah,
Remember,
that's
you
true.
regulate sleep. Your
Yep.
body regulates sleep. They have trouble falling asleep. And then once they are asleep, they have a lot of trouble waking up. They can be bears in the morning.
Yeah.
Like that's one of the biggest challenges that parents will have is like getting their child up, dressed, fed, and
Hmm.
out the door to get to the, school bus stop on time.
So I'm gonna take you a little bit into the future when we are talking about high school and college. Um, because I feel like in elementary school, there are so many tools out there. Whereas when they come into college and high school, even middle school, like I mentioned before, and they need to read those lengthy novels that might
Hmm.
not interest them at all,
Hmm.
or Shakespeare, which is a totally different kind of English. How do we
Yes.
help them? What can we do? How can parents support their kids with, like, let's say, reading The Outsider, which is a very popular middle
Hmm.
school
Hmm.
book, not very interesting to many students,
Hmm.
or Shakespeare for that
Hmm.
matter? What do we
And
do?
the Outsider actually is on Broadway right now. Is a play on Broadway. So there are very good questions. Every question you've asked today, Mine. So thank you. So there's so many good strategies and approaches you can take to help students who struggling with reading lengthy texts that are at a much higher reading level. So again, their ability to decode those unfamiliar words is going to significantly negatively impact their understanding. So ebooks is a wonderful thing, and following along with the text. Now, sometimes that multitasking aspect for a child with ADHD is difficult, but you know, you can get through. I don't know why this isn't really common knowledge, but through the Blind and Dyslexia Association, you can get any textbook recorded and then made available as an ebook. So being able to listen to what you should be able to read, but you can't, and there's no embarrassment there,
Right.
is really helpful. Also, all those strategies like choral reading, partner reading. So if you're working with a child, as a parent with ADHD who is having trouble sustaining attention to the text, encourage them to like use different modes of expression. So as they're reading, that makes that text more engaging to them if they are using a different voices. And also if you're reading chorally, meaning reading together, paired reading or alternate reading where you read one paragraph, the child reads the next paragraph, so it gives them a little brain break there. Following again, not like nowadays, like with Kindle, I mean, so you can just the text will be highlighted for you so you can easily follow along. um, and if you have to read the text aloud to your child while they follow along, and then stop every couple pages and ask some questions so you can check in on their comprehension, that's really helpful too. And then sometimes too, they need a study partner.
Yeah. What I've
You know,
been find useful is that I do that with my clients. And we will stop and we'll like take turns. And also um, doing like little sketch notes on a post-it.
Yes.
Because these books are from school. Please don't join the books.
Right.
But but you
True.
can definitely, unless you're getting your own copy, which I'm totally for it. Um, but also can do like a post-it because I love sketch notes and it's something I've been
Yes.
doing a lot with my clients. Also visualization. And you talked about Linda Bell and visualizing and verbalizing is an
Yes.
amazing, amazing program. And doing like, okay, what do you see in your mind for Johnny? You know,
Right.
writing them,
Right.
you know. I don't know why I have the outsider in my head, just because it's so popular right now in
It
my
is
in
very
my
popular.
in my
It's very
students group
popular.
that I have. So this one it came to my mind. What do you see for Johnny or whatever
Right.
Dale when when they're hitting blah blah. So
Right.
this is something to think about is using visualization.
Mhm.
I had a client who needed to read something for social studies, and I will never forget that because I said, okay, I want you to visualize what is happening. I think it was the Boston Tea Party or something
Oh,
in the
yeah.
realm of that. And she imagined, she was also very talented dancer. I mean, I don't work with her anymore. She graduated services. She's now in college. And
Awesome. You did a good job then. You did a good job.
yes. Oh, she did the job. She did most of the job. I just guided her through it. So she was just like, it was so fun, so creative. Sometimes she danced to the movement of what she thinks was happening. So we kind of using their strengths. And many of our clients, as you know, are extremely creative and outside of the box thinkers. And
Yes.
just using their creativity is the win. Okay. This is where we want to get them to do. And I remember her saying that, oh, I imagined them sitting in my living room holding their tea like this. And she was like holding her hand like sipping tea. And I found that hilarious. So if your child is into theater, if your child likes to sing, dance, draw, use it, have them do
Absolutely.
that.
Absolutely.
Especially when they're reading something that is boring for them,
Hmm.
or they will not remember, or they have challenges with working memory. Um, Sometimes you cannot take medication, and I want to talk a little bit about that, especially, you know, I've been working with different clients, and some of them had some other underlying health challenges, and then medication was not part of
Hmm.
the treatment plan, so and so. And so what would you recommend doing? Because then we definitely see challenges, especially in middle school. You see a gap with the reading and with the writing. So we are going to finish with that. So what can your tips can be for when we are not using medication?
So again, reinforcement
Hmm.
is so important. So many opportunities, and whenever you can change the modality, um, is really helpful. Like you were mentioning, the creative, component of it. Um, Again, when kids can interact with the text and they can write in the margins, having them make up their own little coding system. Okay, so if there's a word that you can decode it, you can read it, but you don't understand what it means, then you're going to put a box around it. So just like coming up with like a coding system to help them as they're reading to interact in some way, with the text. Writing, we could probably do a whole session, another podcast
Hmm.
on writing, because writing is the most difficult of all of the academic requirements for children with ADHD because it is so cognitively dependent on working memory and
That's right.
organizing thoughts and ideas and being able to attend to punctuation, capitalization, complete idea units. I mean, there's just so many different just challenges for individuals with ADHD. But now we also have speech to text, which has changed everything. And now we have AI, which is helpful as well. The other thing I didn't mention regarding just some other strategies I'll throw out there that might be helpful to our listeners is that one way to help kids, and actually one of my colleagues was the first, she was at St. Joseph's University in Philadelphia, was one of the first individuals to write a research article on this. So using closed captioning with when kids are watching TV is really helpful. Because then they're attending to the text on the screen, and that helps them, believe it or not, build vocabulary as well. Um, Again, highlighters, the highlighting strips, and to be able to say which color do you want to use today when you read aloud? Yellow, blue, or pink? Anything you can do that acts as an external cue. You mentioned the little post-its are really helpful. Also, magic markers. Again, highlight the words that you had, difficulty reading, you struggled to read. Highlight the words you don't understand the meaning of. And what, and again, chunking. Chunking is very important too, because the ADHD mind gets overwhelmed very quickly. So breaking things into chunks. So you have 10 pages to read for an assignment tonight. Okay. Let's make a plan. When are you going to read and how much are you going to read? So you're going to read like 3 pages at 4 o'clock, 3 pages at 5 o'clock, and 3 pages at 6 o'clock. Add one more, you're done. Sitting down to sustain attention to read 10 pages is overwhelming. Also, we also know that ADHD individuals do well with a body double. So, what does that mean? Having another body in their room just gives them an awareness that there's this expectation that I'm supposed to be working on something. I use that a lot with adults that I work with.
Yeah,
Like, so you
same.
want to get your closet organized, you need to get a good friend who'll just sit there and talk to you as you're doing it, you know. So there's just so many different strategies. And then asking kids, we don't take the time, I think, to ask our students, what do you know works for you? Because a lot of times they are not a lot of times, they're always so insightful, and they're able to tell you, well, when I'm chewing gum, I
Mm-hmm.
read better when I'm chewing gum. But my mom doesn't let me do that. So now you have to convince parents it's okay. But again, the creativity, that creative piece, kids don't have to be sitting in a chair. They can be reading, walking around.
Yes.
They could be reading, to the dog or the cat,
Mm-hmm.
hey, I think my, cat would really enjoy listening to that story. I'm going to go and grab him. So, just again, whatever you can do to involve more senses, multisensory. That's why Linda Mood Bell, that's why their comprehension program, visualizing, verbalizing, works so well because it's a multisensory, multimodal approach, and then letting kids just be creative, letting them be creative, um, and still keep talking to parents about the benefits of medication. Have them talk to other parents. Have them go to a chat meeting. You know, you have to also educate them. They're scared. They don't understand.
Mm-hmm.
So, it's you wouldn't let, they say this all the time, but you wouldn't let your child who has to squint to read the whiteboard, you wouldn't let them go without glasses, would you?
That's right. With that note, I wanted to thank you for your wise words. It was
Thank
absolutely
you.
fun. I learned a lot, and I hopefully our listeners learned too. And I would love to have you again. We can talk about
Thank you.
writing.
I would love to do that. I've enjoyed speaking with you as well as all your listeners, which are probably mutual colleagues of ours. So hi everybody. Great
And
to
parents,
as parents, oh, and parents need to support each other.
yeah,
It's so important. Seek out support. Seek
it
out
takes a
support.
village. I
It
mean,
does.
we don't need to, we're so isolated in our lives, and it's
We
okay
are.
to ask for help. And it's really so important
It's
as
so
parents
important.
to
And and
support each other.
and I just want to, if I can say one last thing about medication that might be reassuring to some listeners who are parents who are like, do I medicate my child or not? I personally know So many people who have taken medication for 30, 40 years with no side effects. We know when you don't take medication, you have more visits to the emergency room. You have more car accidents. Okay, you're at risk for depression and anxiety. You're at very high risk for alcohol or drug abuse.
Also dementia, by the way, in the
Yes,
later year of your life. So early intervention is always a key to success. Um,
very much so. Thank you.
Dr. Mary Beth, thank you so much. We
Thank
will talk
you.
soon. And to our listeners, have a wonderful rest of your day or night if you're listening it in the evening. Bye
Thank
bye.
you. Thank you. Bye. Bye now.